also the pioneer founder of a sickle cell clinic of Onikon Health Center, Lagos, and a trained genetic counselor in sickle cell disorders. His special interest, of course, is care and management of children with a sickle cell disorder, hence his being here. You're welcome to the studios, Dr. Tunji Alakija.
Thank you very much.
Yes. So last week, we highlighted, we tried to touch. I mean, 30 minutes is just really never enough, but time flies. It just never works for anybody. But we are trying to do our bit, hence this show. And you should know that this show, Surviving Sickle Cell, is a special show in honor of the memory of our beloved Tosi Buckner, who passed last year. And we say that may her gentle soul rest in perfect peace. Are we trying to live up her legacy? Exactly. That's what we're trying to do. Today, we're going to be looking at a couple of other complications. Last week, we had one in the studio. For some reason, yes, Cadmus, something like that. Yes, that was his name. And Dr. Akin Shete was here. Today, we have 3 different families. My goodness. I have Mr. Vincent Osigu. Yes, you're welcome to the studio, sir.
Welcome, sir.
Yes, he's a parent of a sickle cell child who's 17 years old and also goes by the name Vincent. I like to call him Vincent Jr. I'm not sure if he's okay with that, but yes, it's a pretty looking boy. And then we have Mr. Khalid Ismaila.
Thank you.
Welcome, sir. And we have, can I see his name now? Mr. Shuaib. Yes, the father of Zainab Shuaib. You're welcome to the Inspiration of Family Neighborhood. So we're going to look at, some of these things, complications that these parents have had to deal with their child or their children, so to speak. And we're going to start really first with Mr. Vincent Osegu, who has the 17-year-old Vincent Jr. Yeah, and tell us, what was it like for you from the very beginning when you discovered that Vincent had the sickle cell disorder?
Actually, I was not really very happy about it at the beginning of it all. But later on, I discovered that it is a general problem which can easily be managed,
Yes.
And up to last year, we've never had serious problem. Except that by last year, he started having a lip. He has some kind of pains at the hip,
Okay.
which transmits to femur, and then started lipping.
Okay.
So we took him to the hospital. We were given some kind of pain relieving, but later on we discovered that I think a little bit shorter than one leg is now becoming a little bit shorter. So that was exactly what now led us to the last clinic, which the doctor now said we should do some editing for us to know exactly what
is wrong.
Yeah.
Okay, so how long did Vincent complain for before you realized that you had to take him to the hospital?
For this same leg, or
Yes,
before we discovered?
No, the leg.
The leg
For
was
the hip.
like I said, since last year.
Okay.
He was in school, so we thought it was the condition of the school.
Oh.
We thought it was where he was sitting, how he was sitting, and that was what we thought. So by the time we changed his school and his table and chair, we still discovered that the pain was still there. So we had to take him to the hospital. I know the hospital is like on what do you call it now? Dates. They have to give us dates for us to come. So by the time we went there, we discovered that the pain was really a kind of crisis from the sickle cell, and not just how it starts.
Okay, still with you, Mr. Vincent. So I find it most amazing that they are all fathers in the studio with me this afternoon, because what we hear oftentimes is that fathers are not exactly very supportive. But I dare say that notion is not completely right. I mean, here are fathers with their kids. So I want to say kudos to you. I want to give an applause to all the fathers in the studio with me. I think that you guys are absolutely amazing. This is from me as a mother, as a woman, as a wife, giving you guys a thumbs up for standing by us, the mothers of these children, and being a father really to your child in the time of need. we say God bless you all.
Thank you.
Okay, so to Mr. Ismaila.
Yes, ma'am.
Mr. Ismaila.
Yes.
Okay. I know that one of the complications that Dr. Alakija and even Dr. Akinshete have mentioned is stroke.
Yes.
And I find that really shocking because growing up, when we hear stroke, it seems like it came with age. You know, you have to be old first
Yes,
before, you know, you suffer stroke.
Yes.
So when your child was going through this, did you know that it was stroke? What were the things that you saw?
In 2014,
Mm-hmm.
when we go to youth, then they stay in head to say the RU is very high. RU is very high. The content of say one day maybe this boy will get stroke. So one time, one in the night, the content was say head dey pain me. So when he sleep around 3 o'clock in the midnight, when he wake, say he wan go hit himself, so immediately he fall down. So when he fall down, so his sister when we come together now, come tell me, daddy, come see Kali. When I come out, I see Kali don dey shake him hand, dey shake him leg, dey shake. So I think what happened, immediately I take him. From there, we take him to the hospital Mercy. So when we reach Mercy, so that I don't get the stroke. In left and the right and the left leg and the left hand. You can't feel carry it up. So immediately they admit us there. When they admit us there, then give us benedict. Immediately they give me drip. They drip me. When we reach about 2 weeks in there in the Mercy, so anything never change. So the doctor come give us the notes. He make we go to
Another
Ikeja,
hospital.
no Ikeja,
Okay.
Ikeja
General
hospital.
hospital.
So when we reach there, they tell us say no more bed here. So the doctor come immediately. Doctor see the woman and sweat because he hold on Baba. He can't give us notes. He make we go back to the youth. Immediately we reach youth, then assist us, then give us bed, then admit us there. We reach 1 week there. So they're starting to treat him. After, then can't give us the bed. They carry us to go one side, then do X-ray for him. They put him inside the thing, then do X-ray for him. They say nothing happened to him, but his brain, but his brain is okay. But from there, then they give us, then they give her injection, then they give her drip, then they give her injection. After they come discharge us, say make you go from there. I get one stick for her. It doesn't work. Small, walk, small. From there, he get up. Something okay, but I can't feel work like before. You don't get some you don't get some.
They get us to the waka.
As the waka, so.
Okay.
But we are thank God.
Thank God. All right, thank you so very much. That's the ordeal of Mr. Ismail and his son. Also in the studio with us is Mr. Shoaib.
Thank you very much.
How are you, Mr. Shoaib? Okay, so Mr. Shoaib has a daughter who is 14 years old, but weighs about 20 to 21 kilograms, which is very unusual, which is about the weight of a 5-year-old. I find that most astonishing, and I'm wondering, Mr. Shoaib, how did you feel when you realized, when you see, say, if you like, say, your pikin, you know, they grow, what's in come your mind, and what do you do?
I don't feel like that that motion because sometimes if I give her food, never eat am well.
No, they chop food.
Yes, no go chop food well. So because that madam when we bring her to that mercy now, it's not her father, it's not her mother. The mother is there. So now only me just do that thing. If you see, if I come for anywhere, if they for anywhere, I run to house to come take her to hospital. So from there, he reached 5 years old before I know that is my child.
No, they grow.
No, my child is
okay,
SS.
SS, okay.
So from there, I don't do anything. I just pray for my Allah. Oh my God, to bring to do anything, to do some things
So bless
for
your
me
weekend and your family.
To good some what do we call it? To do well because this thing, if I say I don't like her. But just pay me. I don't know anything I could do for him.
Okay.
So I'll take her for 1 day for the nursing. They send me to the Sickle Cell Center to go and do brain test.
Okay.
So if I do tell her, I say that test is good.
Okay.
Even the result that the result of that test stay with me now.
Okay.
So see, nothing.
They say nothing done for your brain. Okay.
For our brain.
Okay.
So how do you do for that? That shots. Those people.
Which time you take no say she short? How old she dey when you take no say be like say this pikin no dey grow short for an age?
Good to 7 years to 8 years.
Okay.
Yes.
All right.
Because that for that 8 years, 5 years, the mom is
still there alive.
Their hair alive.
Okay.
So that's why
Okay.
I discovered that this my child is the way when we did nice long I'm not happy. So the nothing can do for that that the situation where we come. So that's why I just pray for my God to help me about this. I have 3 sickle cell.
3 sickle cell children.
Yes. One dying on November last year.
One don't die.
Yes.
For November last year.
Yes. They remain 2.
Now boy, I've been a girl.
Na guy.
Okay, bless his soul.
So that's my first thing.
And you have been managing it all alone.
Yes, I will manage it because I don't have anything to do. So that's why I just pray for my highlight. Anything will be happen. If they are alive, thank God. If not they are alive, thank God.
Thank God.
Because I don't have anything to do. I don't have anybody to assist me. Accepting. I see just one person, one foundation. Now he just helped me.
The Sickle Cell Foundation of Nigeria.
Yes,
Solage. Okay.
So now he helped me of that situation.
So I want to ask you, say you now you get 2 children, we get sickle cell.
Yes.
I want to ask you, say what thing they give you power, what thing they give you strength to live? But I think say you don't talk because you don't talk say if you die alive, you thank God. You know they alive, you thank God. So for you, now Allah, now you do everything. Abi?
Yes, because I don't have anything.
Now so it's supposed to be. Thank you so very much. Okay, so it is surviving sickle cell. Don't get it twisted. In case you're wondering what is going on, we have 3 families: the Osegu family, the Ismaila, and then the Shoaib, with different stories, different complications with their children. And we have, of course, Dr. Tunji Alakija in the studio with us. Thelma Elams is my name. We'll take a break. When we come back, we'll be talking more with Dr. Tunji Alakija, and perhaps we'll take your calls. Don't go away. Alrighty, 23 minutes gone past the hour of 1. Time just never waits for anybody, right? If you are just tuned in, you are tuned into Surviving Sickle Cell on your number 1 family radio station, 92.3 Inspiration FM. Thelma Illings is my name. I have Dr. Tunji Alakija, medical officer working with the Sickle Cell Foundation Nigeria, Idara Bazule. I have Mr. Vincent Osiebu, a parent of a sickle cell child, and the other is Mr. Khalid Ismail and another Shuaib. They have been living out their experiences as parents who have had to go through the ordeal, really. And just before that break, I was giving absolute kudos to these fathers, because what we hear oftentimes is that fathers are usually not there when all of these crises and when they discover that their kids, have the sickle cell disorder in them. But the story, for me, I don't know about you, I think it should actually change. All right, Dr. Tunji Alakija, before you tell us how people can actually have access to the Sickle Cell Foundation, because I listened to Mr. Shoaib with rapt attention, and I couldn't help but, hear him, the joy with which he said, the Sickle Cell Foundation Nigeria is one that has assisted him and has put him on the right track. So before you tell us how to have access to the Sickle Cell Foundation, let's look at some other complications that I'm sure that you have witnessed yourself.
Okay, let me first of all start by saying that most of the complications that arise because of sickle cell disorder, they do arise because of 2 main things. Number 1, the red blood cell with the faulty hemoglobin in HS is weak. It doesn't last for the normal 4 months that your own, my own, A hemoglobin A. 10 days, 20 days, they have died. And so a lot of hemolysis is taking place all the time. They live very short, so there's not enough blood and so they are weak, they are asthenic, they are not strong, they get tired easily. The second reason why they have complications is because the sickle cells themselves, they clump together at some places, at the tiny capillaries, very tiny capillaries there. They clump together and block the vessel actually. When they block the vessel, it means that oxygen, nutrition that blood carries cannot go to the other organs. They are starved. And so, number one, there is pain in those areas. And number two, those other organs that are not having blood, they die of necrosis, that kind of thing. Now, let me now mention the various complications. I will take it chronologically. In the first 1 year of life, in fact, in the first 1 month of life, we don't see much complication because the blood there has a lot of fetal hemoglobin when you give birth to a baby. And the fetal hemoglobin protects, that's the point, it protects against everything concerning sickle cell. So a 1 month old baby has really nothing. By 2 months, 3 months, 4 months, the fetal hemoglobin now begins to wane, to go down, and the normal hemoglobin of the person begins to show up. At birth, fetal hemoglobin, but then it begins to come down, and now 2 months, 3 months, you begin to see some little symptoms of fever, a little jaundice, a little infection. It can happen. By the time the baby is 6 months old, the fetal hemoglobin has virtually disappeared, and so you have no protection by the fetal hemoglobin. You can now begin to see real malaria. You can now begin to see pneumococcal infection, and that is why we need to give anti-malarials, we need to give some antibiotics at that stage. And close to 1 year, from 6 months, you find the baby having swelling and pain in the hands, pain, swelling in the foot. We call it foot and pain, and hand and foot syndrome is painful. That is for the first 1 year. For the second to the 5th year, we have serious bacterial infection from 2 to 5. That is when we have serious bacterial infection more than any time. And then in Africa also, we have a lot of malaria. So from the 2 to the 5 years is a very bad time for a sickler. Malaria is there, pneumococcal infection is there, infection of the bone osteomyelitis is there. The spleen is not doing its normal work of protection, and so we have a lot of sepsis that affects the lungs, that affects the brain, that affects many parts of the body because the spleen is not doing its work. So that age is very serious for a child, 2 to 5 years. The spleen is not doing its work.
So I want to ask you this before you go on. So if there's anything I noticed from two of the parents is that for each time, they went to the doctor or where it was that they went to complain, they exposed them to an X-ray of the brain.
Yeah,
Why is that?
Yeah, that is, we call it TCD, transcranial Doppler. We want to see how the brain is functioning. We want to see how the blood cells are functioning in the brain. In some of these patients with sickle cell disorder, they succumb to stroke. Some of them, like the other man, some of them have stroke. But if we do the brain scan and see how the blood is flowing, and from the results we can know which of the children are likely to have stroke. The result will say high risk of stroke. In that case, we need to start the child on hydroxyurea to prevent the stroke. If the result says standard risk, it means the blood is flowing well, no problem. If it says conditional risk, it's between the good one standard and the high risk. That is why from the age of 2 to 16, we have to do what we call TCD, transcranial Doppler, for all the children to see which of them is likely to have stroke and start them on something to prevent the stroke. And the final age, between the age of 6 and 12 years, in countries where there's a lot of infection, in countries where there is poor services in health, most children don't make it, and that's it, they'll have died off. But in countries where there is a lot of good medical attention, health services, in countries where infection has been taken care of, most of the children can survive. But we find that most of the children are not growing well. Like the other child of this one, yes, the child, we see that this child is not growing well. She's about 14 and she's weighing only 20 kilograms. The child is not weighing well. Sometimes bedwetting continues. A child of 9, 10, 11, 12, even up to 10, she's still bedding wet. You see that in between 6 and 12.
Okay,
puberty.
Dr. Lack, I'm sorry, I'm just going to have to cut you short. We are out of time. But I'm not going to let you go, on TV. Tell us really, how can people access the Sickle Cell Foundation Nigeria?
Number one, we are at Surulere to start with, Idiaraba. We are directly opposite Luth Teaching Hospital, the first gate of Luth, directly opposite. That's our building.
Okay.
Then we have our telephone 0803 584 6666. I repeat that 0803 584 6666. And we're on website also, sicklecellfoundation.com.
Okay. All right. So we have the kids of the Sickle, Ismail and Shuaib. I'm just gonna have them say hello. I have Zainab directly here with me. Zainab, say hello.
Hello.
Hello. Say I am the light of the world.
I am the light of the world.
Fantastic. Vincent, say hello to your dad's mic.
Hello,
And say I'm the light of the
I'm
world.
the light of the world.
And you, darling.
Hello. I am the light of
Of the world. Fantastic. All right, Lagos, we gotta go. My goodness. Thank you so much, Dr. Tunji Alakija, for bringing all of these families down. Thank you for obliging to come. Thank you so very much. 92.3 Inspiration FM. My name is Thelma Illams. I have to step aside. The Auntie Francis will be coming and giving you, yes, some more great music, more great feeling for the weekend. I leave you with this one. Pray for me. Very alternative.